My name is Tracy Shimalecki, and I have worked for Atlanta Oral and Facial Surgery for 23 years. And what I love most about this practice is for that entire 23 years, the number one goal has always been patient care. My priority is to help each patient with their visit to make sure that everything goes smoothly for them. We contact insurance companies to try to maximize patients' benefits and try to minimize the out-of-pocket expense for patients. And I look forward to serving you.
My name is Dr. Stephen Bankston. I'm an oral and maxillofacial surgeon with Atlanta Oral and Facial Surgery. This is beginning my 14th year of practice. My undergraduate career and also my dental school career was at the University of Pennsylvania. I completed my hospital-based residency at the University of North Carolina at Chapel Hill. I then proceeded a year-long craniofacial trauma and reconstructive surgery fellowship at the University of Miami. And then I taught at what was then the Medical College of Georgia for 1 year prior to joining Atlanta Oral and Facial Surgery. What motivated me to start practice with Atlanta Oral and Facial Surgery is I was looking for a cutting-edge, really sophisticated, leading practice, which is what this practice represents. The things that I want the patients to know that are the most important things about my practice and what separates it from others is that over the course of the last decade, we've developed a culture and a philosophy that has 3 pillars that are involved. The first is patient education. We want all patients to feel totally comfortable when they come to us, that we're going to take great care of them, that we're going to educate them, that we're going to listen to their concerns, and that we're experts in anxiety and fear management, and that we're going to make them feel very comfortable. We want them to leave the consultation visit to feel empowered, educated, and really informed about any proposed treatment. The second pillar of my practice is combining state-of-the-art technology with the latest cutting-edge techniques for surgical procedures. I've been fortunate enough to train with in the leading institutions in this country by some of the most talented professors over the years. On that base of training, I've combined hundreds of hours of continuing education to stay on cutting edge to provide the latest care for patients. I've also written book chapters. I've lectured locally, nationally, and really my goal is to take great care of patients. The third pillar of our practice is we realize is to take care of patients after surgery. The surgical procedure is only half the battle. It's the postoperative care. And that's why we give people realistic expectations about what to expect from their procedure. We provide them detailed instructions about how to take care of themselves after surgery. I think the thing that keeps patients coming back to our office is our attention to detail and sort of really going the extra mile and making patients feel comfortable, not only in the surgical outcome and throughout their postoperative period. When a patient walks into my practice, they can expect to be treated like one of my family members with the utmost respect and attention to detail, and we're really going to take great care of the patient. I'm known best for taking on challenging, more difficult reconstructive cases. I find these cases to be both very rewarding for myself and for the patient. I want all my patients to know that our number one goal is to take the best care of you and to do a great job for you.
My name is Michelle Harriet. I became a patient of Dr. Bankston in 2002 due to a gunshot wound that shattered my jaw. Dr. Bankston helped me through this traumatic experience by making me feel safe. He made me feel comfortable, and he gave me so much information to go off of to allow me to feel comfortable with him and know that this is the best thing for me. I just felt, because of the compassion, I guess it was, the way he related to me, my situation, it allowed me to be like, okay, if you feel that's best for me, then I would do that. I trusted him. My care turned out to be excellent. The results were, when I'm out, people can't even tell that I had anything done without me pointing it out.
My name is Dr. Henry Blair. I'm a board-certified oral and maxillofacial surgeon. I've been in private practice with Atlanta Oral and Facial Surgery for 3 years. I started my training at Tufts University, where I did my dental school training. Then I moved on to Emory University in Atlanta, Georgia, where I did my oral and maxillofacial surgery training. That was followed up by a 1-year fellowship at The Ohio State University in Columbus, Ohio, where I studied and performed advanced bone grafting techniques and implant surgery. So I knew I wanted to be an oral and maxillofacial surgeon about 13 years ago when I first worked for Atlanta Oral and Facial Surgery as a surgical assistant. I had a year off in between undergrad at Auburn and I going to Tufts University. And during that time I worked as a surgical assistant for Atlanta Oral Surgery, and that's when I kind of got a great idea of what a private practice oral surgeon performed. And over my years of training at Tufts and Emory, I kept in close contact with Atlanta Oral and Facial Surgery and have now come full circle, and I'm a surgeon with the group, which is exciting. My practice consists of IV sedation and general anesthesia, extracting teeth, whether it's a single tooth extraction or full bony impacted wisdom teeth, implants, whether that's a single implant or full mouth reconstruction with dental implants. Practice also consists of benign pathology, facial trauma, and some facial reconstruction orthodontic surgery. And I think what our practice is best known for is a few things. There's a 15 to 30 minute consult that I have with each patient beforehand. We're really known for informing the patients of why they're here, what's being done, the risks and benefits of the procedure that they're going to have, and we really try to make them the focus of what's going on. We also take pride in providing great, excellent surgical care. And probably most importantly is the follow-up that we give patients. We kind of have an open door policy here in this practice, and I keep saying we because none of this can be done without a great staff, which I have. We give great post-operative follow-up, and that includes an open door policy. Any patient who I've done surgery on is the most important person in my practice, and they can come back and see me whenever they need to. If they're having a post-operative issue or question, that question gets answered not only that day, but within 30 minutes or so of when they call. If they need to be seen that day, then they can be seen that day. I want all my patients to know that they're going to get excellent surgical care and excellent treatment in this practice. They will be the most important person, or they will feel like the most important person in my practice. And me and my staff will strive to make them feel special.
My name is Brenda Fouts. I have been a patient of Dr. Blair's for 1.5 years. The procedure I was sent to him for was to have posts put in my gums. He has been nothing but professional. The nurses are wonderful, they're professional, but not only are they professional, they treated me like a part of the family. They babied me, and during my procedure, it was wonderful. I mean, it all went real well, and if anybody asked me about Dr. Blair, I would absolutely tell them, go to Dr. Blair if you want this procedure done, because he is one of the best. You will not see anybody no better than what he is with the procedure. And they really did. They were really good to me.
I'm Dr. Tom David. I'm a dentist, and I've been with Atlanta Oral and Facial Surgery for more than 5 years. I provide diagnosis and non-surgical treatment for patients with facial pain and orofacial lesions. What sets Atlanta Oral and Facial Surgery apart from others is the nature of the comprehensive care that's provided for the patients in the practice. When a patient walks into our office, they can expect that they will be treated promptly, with care, and with attentiveness to their chief complaint. What makes Atlanta Oral and Facial Surgery unique is the ability to provide comprehensive care in a number of different practice settings throughout the Atlanta area, paying attention to the complaints that the patient have and making sure that those are addressed. When patients make an appointment in our practice to see me, presumably they have problems with facial pain or orofacial lesions, and I'd like for them to know, number one, that I've had more than 20 years of experience in treating these patients. As a matter of fact, I've treated thousands of patients, and based on that experience, I have the ability to take a history from them and be able to decipher the things that are important and offer them a number of options with respect to non-surgical care. One of the things that a lot of patients have anxiety about when they come to see me is that they are fearful that they will require surgical treatment, and the fact of the matter is that less than 5% of our facial pain patients end up needing surgical care. So they should probably feel relaxed and less anxious about the fact that they're going to require surgery.